Hi, I'm Bill Osmolsky with the MacIver Institute, and this is your MacIver News Bulletin. It's Wednesday, March 25th. As of this afternoon, 578 people in Wisconsin are sick with coronavirus. That's an increase of 128 from yesterday. Most of the increase happened in Milwaukee County, where 71 new tests came back positive. Overall, throughout the state, 6 people have died from coronavirus. But Andrea Palm from DHS says that number is about to explode. That's why Governor Tony Evers issued a new emergency order on Tuesday. But it's not much different from what everyone has already been doing.
Shrinking your circle of interactions will help prevent the spread of COVID-19 to make sure our healthcare system doesn't become overwhelmed. Unfortunately, that means no potlucks, no play dates, and no dinner parties.
Governor Tony Evers' shelter-in-place order went into effect on Wednesday, March 25th, and will last for a month. It apparently doesn't change any restrictions on businesses. However, gatherings are limited to 5 people, and individuals are only allowed to interact with people in their household. Department of Health Services Secretary-designee Andrea Palm warned that the way things are currently going, 1,500 Wisconsinites could be dead within the next 2 weeks.
Our experts are comparing our data to the Wuhan and Italy experiences to predict what is likely to happen here in Wisconsin. And if we continue on our current path without implementing safer at home to flatten the curve, the models show us that we would likely have 22,000 Wisconsinites who are positive for COVID-19 by April 8th and an estimated 440 to 1,500 deaths.
On Tuesday, Wisconsin Attorney General Josh Kaul got 15 other states to join him in an effort to demand President Trump assume dictatorial powers and nationalize American industry. Under the Defense Production Act, Trump could force companies to manufacture medical supplies like masks and respirators. Kaul says that there are currently widespread shortages of these critical supplies. Meanwhile, Wisconsin Department of Health Secretary-designee Andrea Palm doesn't know what the state healthcare providers might need, but she's committing to grabbing up as many medical supplies as possible for the state.
We've requested as much as we can get our hands on, I think, is probably the thing to say about that.
As of Saturday, the Strategic National Stockpile has given Wisconsin 52,000 face masks, 130,000 surgical masks, 25,000 face shields, 20,000 surgical gowns, 100 sets of coveralls, and 36,000 pairs of gloves. The state has not reported how much it's been able to secure from private vendors. President Trump has repeatedly ignored demands for him to seize dictatorial power. He insists the free market is superior to central economic planning, especially during a crisis.
We're a country not based on nationalizing our business. Call a person over in Venezuela, ask them how did nationalization of their businesses work out? Not too well. The concept of nationalizing our business is not a good concept, but I'll tell you why. As Peter said, we may have to use it someplace along the chain, but we're getting calls. Here's the beauty of it. If we go out and we want, let's say, masks, we don't know who to call on masks, but Hanes, who makes things of cotton, various elements, lots of things, it's a great company, they called us and they said, we're going to make millions of masks. We got a call today from 3M. There's a big article today, the head of 3M. They're going to make tremendous products, and they're more or less in that business. And if they're not, like for instance, General Motors spoke to us, Ford spoke to us about doing ventilators. The beauty is they're calling us. If you go the national route, nationalization route, we're going to tell a company to make a ventilator. They don't even know what a ventilator is.
The MacIver Institute is posting new charts and tables every day that break down Wisconsin's coronavirus data in a way you won't find anywhere else. Check it out on our website, www.maciverinstitute.com, or on our Facebook and Twitter accounts. For the MacIver Institute, I'm Bill Osmolsky, and this has been your MacIver News Bulletin.